The UCSF ISMM, it's a bit of a mouthful, I'll be the first to admit it, it stands for the Interventional Spine and Musculoskeletal Medicine Program. It's a fellowship, so essentially once a candidate has completed their residency training in physiatry, they are eligible candidates for this fellowship training program. So our fellowship is a one-year program. The program itself accepts currently one fellow per year. Our fellowship program is a NASS, or North American Spine Society, recognized program, and it's the first of its kind at UCSF.
Dr. Paolo Membella and I are sort of spearheading the program. We have excellent interventional spine attendings. So at UCSF, there are a total of 6 interventional spine attendings. All of our attendings work in different locations across the Bay Area. So we obviously have the mothership UCSF in San Francisco, but we have other attendings up in Marin, East Bay, South Bay, at the General. So the fellow is going to have the opportunity to rotate with all of these different attendings and see a very different demographic of patients.
UCSF strives to be a global leader, not just a national leader, in the realm of medicine. That is all specialties under the sun. Having that infrastructure available to our fellows is a tremendous value, tremendous benefit that if they take advantage of, it gives opportunities for publication, opportunities for talking at the local, national, regional, even international level, and really sets them up for a very successful career in academic medicine. Fellows will be exposed to all of the bread and butter procedures that are typical of a spine fellowship program. These would be epidurals, medial branch blocks, radiofrequency ablations of those nerves when indicated, from the cervical, thoracic, lumbar, and sacral spine, as well as the non-bread and butter procedures. Some of the advanced procedures that are well known in our field, things like kyphoplasty, vertebral compression, fracture treatments, even exposure to neuromodulation, and some other newer forms of neuromodulation. Reactivate is one particular procedure that comes to mind that a couple of our faculty are trained in. Our fellow is going to rotate longitudinally with all 6 of our core faculty. That longitudinal exposure to their clinic, to their procedural suite, will give the fellow the chance to see the patient pre-treatment, during ongoing treatment, and then hopefully treatment resolution. Our fellows also run their own clinic. So their clinic is 1.5 days a week. Our fellows will be running a general physiatry and musculoskeletal clinic.
I think that's going to help them kind of learn how billing and coding and all of these other things work, because in residency, that's not really something that you learn how to do.
Typically, our applications open from about January. We're receiving applications through maybe late March, early April. In April, we narrow those candidates that have applied down to a select few that will be granted an interview. Interviews typically run between May and June.
We would love to have a fellow that is very academically interested. So they have interest in medical student residency education, people who maybe have a really strong interest in research and, community outreach. Those are all of the things that we really value from a UCSF academic standpoint. Thank you so much for your interest in our fellowship program, and we really look forward to hearing from you.